The escalating measles outbreak in Texas has reached alarming proportions, with at least 90 confirmed cases, a number unprecedented in recent history, according to state health officials. This surge represents a significant public health crisis, marking the worst outbreak witnessed in 3 decades. The alarming rise in cases underscores the urgent need for increased vaccination rates and public health interventions to curb the spread of this highly contagious disease. The demographic breakdown of the infected population reveals a concerning trend. A majority of the reported cases involve children and adolescents, with a substantial portion, 51 cases, affecting minors aged 5 to 17. Children under the age of 4 represent another significant group, accounting for 26 confirmed cases. This concentration of cases within pediatric populations highlights the vulnerability of young children, whose immune systems are still developing, and the critical role of timely vaccination in protecting this vulnerable demographic. A disconcerting factor contributing to the outbreak's severity is the vaccination status of the affected individuals. In a substantial number of cases, parents had opted out of vaccinating their children against measles, a decision that significantly increases the risk of infection and contributes to the rapid spread of the disease. In other instances, the vaccination status of the patients remains unknown, further hindering effective containment efforts. This highlights a critical gap in public health infrastructure and underscores the need for more comprehensive data collection and reporting systems. The epicenter of this devastating outbreak is Gaines County, a rural area in western Texas, where a staggering 57 cases have been reported. This concentration of infections within a relatively small geographical area is alarming and points to the need for targeted interventions and resource allocation in this specific region. The county's population of 22,523 residents is further compounded by its unusually high immunization exemption rate for the 2023-24 school year. According to data released by the Department of State Health Services, DSHS, nearly 18% of students in Gaines County received exemptions from required vaccinations. This significantly high rate of exemption directly correlates with the outbreak's severity and underscores the alarming consequences of vaccine hesitancy. This alarming trend of vaccine exemption, fueled by misinformation and skepticism surrounding vaccine safety, has unfortunately contributed to the resurgence of measles and other preventable diseases. The consequences of such decisions are far-reaching, impacting not only individual health, but also the broader community's well-being. The consequences are especially evident in regions with high concentrations of unvaccinated individuals, where outbreaks can spread rapidly and overwhelm healthcare systems. The public health implications extend beyond Texas's borders. At least 9 cases have already been reported in Lee County, New Mexico, a region bordering the affected area in Texas, highlighting the transboundary nature of this outbreak and the need for coordinated regional public health responses. The interconnectedness of communities necessitates collaboration and information sharing across state lines to effectively contain the spread of the disease. The current outbreak is not an isolated incident. The United States experienced a significant increase in measles cases in 2024, with 285 reported cases, the highest number since 2019, when nearly 1,300 cases were recorded. Children under 5 years of age account for a disproportionate share of these cases, representing 42% of the total. This alarming national trend further emphasizes the critical need for renewed public health efforts to promote vaccination and combat vaccine hesitancy. The severity of the Texas measles outbreak serves as a stark reminder of the importance of vaccination in protecting individuals and communities from preventable diseases. The readily available and highly effective measles vaccine has virtually eradicated measles in many parts of the world. Yet the current outbreak underscores the fragility of this progress and the devastating consequences of waning vaccination rates. The situation demands immediate action, including targeted vaccination campaigns, robust public health messaging, and collaborative efforts between healthcare professionals, public health agencies, and communities to effectively control the outbreak and prevent further spread. The future health and safety of children and communities hinge on addressing vaccine hesitancy and promoting widespread immunization. The potential for further outbreaks remains high, and urgent action is necessary to prevent a larger-scale catastrophe. This outbreak underscores the critical need for continuous vigilance and proactive public health strategies to protect against the resurgence of preventable diseases.